our department's website, which is publichealth.lacounty.gov. The outbreak of measles that we're currently experiencing is the largest that we've had in this county and in this state in 15 years. Public Health is doing all we can to identify cases and to isolate contacts so as to prevent spread. However, to end this outbreak, we need to do more and we need help. I encourage everyone to review their vaccination status and, if needed, to get the vaccine now. Measles can be a very debilitating disease. Most people fully recover. However, some people have complications, such as pneumonia or encephalitis, and rarely someone can succumb from the disease. Here in Los Angeles County, we've had more than one person already hospitalized, and at least one person has received care in an intensive care unit. So this is a serious disease, a threat to our community, and something against which we must muster all of our resources to contain its spread. Several aspects of measles virus complicate our ability to control its spread. First among these is the fact that it is very contagious. An individual who is unvaccinated and who is exposed to someone who has had measles has about a 90% chance of developing that infection. Measles virus not only can stay active on surfaces for several hours after a person has left, but can remain airborne up to 2 hours, so that if you walk into a room within those 2 hours after an infectious person has left, you could come down with the disease. The second characteristic has to do with its long incubation period, which can be up to 21 days. So when we know an individual has been exposed and we're trying to limit their exposure to others, we have to track and monitor their activities for 21 days. And third, also very important, is the fact that people can be infectious for up to 4 days before the rash actually begins. In light of the fact that the disease has been eliminated, when it comes back into the community, when providers aren't familiar with it, when it can spread because this is one of the most contagious diseases, we feel it's imperative to take all measures that we can to get back to where it's completely eliminated from our community. So while I respect everybody has choices that they can make, the evidence about the effectiveness of the vaccine and the conclusive evidence that the use of the vaccine had eliminated measles from the country in 2000 is overwhelming in supporting the recommendation for people to get vaccinated.